I'd like to introduce Dr. Zaki Rezwana Anwar FRSA, mother and a child health specialist. Dr. Zaki Rezwana, welcome to our show.
Thank you very much for having me.
Dr. Zaki Rezwana, could I come to you? You are joining us from London. Is it also your sense that COVID-19 has disproportionately more impact within certain community, more so than others?
Of course. I mean, if you look at the statistics, there are some papers published. There were, say, few factors, like for socioeconomic factors. I'm not sure whether we have got enough data to conclude that first 10 doctors who died of coronavirus, and we cannot say that they are from the lower socioeconomic background. It's happening in USA as well. The other factors is, say, the obesity. The other one is the underlying condition, because in Asian communities and Black ethnic minorities, they have higher prevalence of hypertension, diabetes type 2. In general, in our skin color, we have less vitamin D. We need to go out for sunshine to have more vitamin D.
Dr. Rezwana, do you just want to briefly tell us what was this herd immunity all about?
Whenever any infection, viral or whatever, we call it antigen. So when antigen enters your body recognizes that antigen and it produces antibody. It's like a soldier to fight with the antigen. So when next time this same virus or same antigen goes inside your body, these antigen, they recognize their enemy and they can fight against it. When a lot of people and a group of people, they have the immunity, that is called herd immunity. And herd immunity can be achieved in two ways. Best way would be the vaccinations. The other way is like when many people, they have the infection and they recognize they have some antibody. But in case of COVID-19, it's a quite new virus and it's circulating among the population who were never exposed to this virus. We don't know when the antibody will be produced and how long it's going to give you the protection. And also, to have herd immunity, you need for different infectious diseases. For example, like for measles, you need 90% people to be immune. And for the coronavirus, COVID-19, you need at least 70%. That means 70% of the total population should be surviving.
Do you feel that part of the response of government is because perhaps they were, if not publicly admitting, but there was a sense that they want to achieve herd immunity through exposing a sufficient number of people to this virus?
I mean, different countries, they adopted different ways to tackle it. One is mostly like suppression, another one is the mitigation. So the British government, they, at the beginning, they thought that they can't suppress the infection, so they will allow the infection in the community, but they will shield the vulnerable populations, like the elderly people. They changed their policy when the death rate was going up. But whether the herd immunity can give a full protection against COVID-19, the only test is Sweden, because here we have the lockdown, but in Sweden they don't have any lockdown, only more than 50 people cannot congregate. So even in Sweden, there's a recent study, 2-3 days ago it was published, even in that situation, they only had 20 to 25% herd immunity, people were immune. So to get 70% of people immune, it means you can imagine how many people have to give their life.
I myself came on the middle of lockdown from abroad, and I saw no noticeable measure from the government in terms of checking, monitoring the people who are coming as to what condition that they are in. So were you surprised when you saw government responding in the way they did to this major challenge of our time?
Of course. I mean, the outbreak started in December. Then the outbreak was in Italy, and then we did get some time to get the preparation. But there are several mistakes. We didn't have enough testing, and we let people come in, and we didn't have any checking in the airport, and no quarantine at all, and no very limited testing. We have been told for many weeks that we will have 100,000 tests, and then we will have antibody tests. The test that came, it was not accurate. So the lack of testing and delay in lockdown, everything.
What you think, whether it's time to even talk about easing lockdown?
Well, before easing the lockdown, thinking of it, there are a few things we need to consider. One is the infection rate, death rate, and another thing is whether NHS is ready to cope if we have the second wave, and if there is any possibility that we have the second wave. We are expecting a big announcement from government in next few days. What government is thinking that, first of all, they will open the schools. A lot of people are saying about RO. It's a very crude measurement, I would say. It doesn't tell you everything. If the RO is less than 1, that doesn't mean that you can't have second wave. Because if the infection time is more, time is double, and the RO is half, you have the same growth rate of the disease. So it's not only the RO. Regarding the school, when you relax lockdown, you first open the schools. There are several reasons for that. In many countries, they have done it. But still, I would say it's too early. And even then, you don't know how it's going to happen. For example, in China, each child, they're wearing a hat which has got 1 meter stick on either side. That means you are maintaining 2 meter distance. And they have got clear guideline, but we haven't heard any guideline. Now, at this stage, because of lockdown, it is possible for us when we go out to maintain the 2 meter distance. But when you relax a bit, it won't be possible to maintain the 2 meter distance. It won't be possible. A lot of children, they will come by public transport. So if you maintain the 2 meter distance in a single story bus, you can't have more than 5 people. In double decker, you can't have more than 15 people. So if you release the lockdown too early, you won't be able to maintain the measure.
Do you share the sentiment that perhaps government isn't providing sufficient clarity and leadership?
Yeah, the primary report, the proposals are those who can work from home still will work from home, and the different factory, they should have a rota to maintain the distance. For example, if in one building there are lots of offices, they share the same bathroom, so they have to improve that, and also how many people can use the lift. There are so many things. I mean, understand, till you spell out everything, people won't feel comfortable to go back to work.
So your sense is that even if we look at government guidelines, it's not sufficiently detailed and clear as to how.
Not only that, we are not ready yet.
Yeah. Dr. Zaki Rezwana, if I come to you, I mean, what is your sense as to how the NHS has responded?
No matter how sophisticated any health service is, it is difficult to face this kind of pandemic. But a lot of things they are outsourcing to the private ones, like to the KPMG, Deloitte, and Boots, for the preparation or distribution of the PPE and other, the testing centers. NHS has managed pretty well, not that bad. We are lucky here. I know a lot of people, they are losing their job, but in other side of Atlantic, your healthcare is related to your
job.
Employment. At least here, even if you lose your job, you have the basics. Till now, I don't know how long it's going to last, but till now, you have the minimum access to your health service.
Thank you. Perhaps this pandemic is being used to allow a lot more private sector through the back door. Is that a criticism well-founded in your view?
Government is outsourcing many of the tasks privately, and the main worry here is that these tasks are going to the private sectors without giving the tender in public. It just went straight away to KPMG, to Deloitte, to Boots, and another US data managing company. It happened very quickly, so we didn't know much about it. The people in NHS, they are working day and night, and they are the backbone of the NHS, and they are working fantastic, but the government should be accountable, and people who are inside NHS, outside, and all the pressure group, they should be asking the government the questions. This is the immediate question, is whether we are ready to protect our frontliners in NHS.
Thank you. Thank you.